Hi, I'm Nikita Teresa Justin, NIKHATHA That's my Seneca student ID, and I'll be showing the room as well. So the patient is having elevated temperature and blood pressure, hypertension, and tachycardia could be the result of underlying cardiac issues. The respiration and temperature of the patient is normal. So I'll be asking you some questions. Moving on, is that okay with you?
Yep.
Have you got any shortness of breath?
I don't think so.
Any dizziness or vertigo?
I feel just tired.
Any chest pain?
I have an ache in my upper chest.
So the patient stated that he has chest pain. I'll be doing OPQRS-TU assessment on chest pain. Have you got any palpitations?
Nope.
Any dysphagia?
Nope.
Any nausea, vomiting?
I'm nauseous and I did vomit once.
How's your bowel habits?
It's normal.
How's your appetite?
It's good.
I'll be taking a look at your heart and abdomen now. So I want you to turn your head in a 45-degree angle to your left with your neck relaxed. So the patient appears normal. He doesn't have any edema or diaphoresis. There is no jugular venous distension noted. There is no increased work of breathing noted. He's behaving normally, and his color is normal for the ethnicity, and there is no pulsation noted. With his gastrointestine, there is no bruising or jaundice noted. It's the color is normal. It is symmetrical. The umbilicus is midline. There is no rashes or scars or lesions or striations noted. Can you lie on your back, please? So his contour is a little bit rounded, whereas flat is the normal. So I'll be pulsating your pulses now. Radial, brachial, carotid, and dorsalis please. I'll be looking for the cap refill as well. It's normal and it's less than 3 seconds. So I'll be listening to your heart sounds now. So with the diaphragm of the stethoscope, I'll be listening for S1, S2, and other abnormal heart sounds, starting from the second intercostal space, which is the aortic, moving to pulmonic and Erb's point to the third intercostal space, tricuspid, and mitral. So that's the point of maximal impulse where we'll be looking for 1 full minute to hear the apical pulse with the patient suspected of having irregular heart problems. We'll be looking for 1 full minute of apical pulse, and with the bell of the diaphragm, I'll be looking for any murmurs. Murmurs are swishing or turbulent sounds heard between S1 and S2. So starting from aortic, pulmonic, Erb's point, tricuspid, and mitral. So there are no murmurs heard. And I'll be auscultating the bowel sounds now. So I'll be starting from the right lower quadrant, moving in a clockwise direction. The major organ found in the right lower quadrant is appendix. Moving upwards, it's gallbladder, stomach on the left upper quadrant, and descending colon on the left lower quadrant. So his bowel sounds are normal, and I'll be percussing his abdomen now. So with my non-dominant hand and my middle finger hyperextended, I'll be tapping with my dominant hand. I have to do in a clockwise direction away from the region, away from the region of pain. So general tympany should be heard. Resonance is heard if there is gas distension, and dullness will be heard if there is a distended bladder or there is fatty tissues. So now I'll be doing palpation. I'll be doing light palpation. I'll be using three of my fingers. I'll be going 1 to 2 centimeter deep in a clockwise manner, covering the whole abdomen, starting from the region away from the pain. No lumps or masses are noted. So the patient is a 63-year-old female presented to ER with chest pain, abdominal pain, nausea, vomiting. So the patient has a history of hypertension, hyperlipidemia, and type 2 diabetes mellitus. In his vital signs, she was having elevated heart rate and blood pressure. She was complaining abdominal pain rating 8 on 10 and chest pain rating 5 on 10. For recommendation, I'll ask for further assessment by the MD or NP. And he needs some pain medication for the management of the pain, as well as orders for ECG and cardiac enzymes or blood works to rule out possible myocardial infarction. So the patient should be having acute myocardial infarction or some gastrointestinal problems such as peptic ulcers. So the nursing interventions for this patient, including administration of pain medication for the pain management and monitoring of vital signs. The recommended doctor's order will be ECG and cardiac enzymes to rule out myocardial infarction, abdominal CT and ultrasound to identify any gastric intestinal problems. Thank you.